So for this segment of our video series, we're going to explore different operating positions and how to position the clients in the chairs, especially if they're difficult, whether they're children or have any type of special needs. So we have Shirley Scott here that'll help us out today. She's an experienced registered dental hygienist, and she has a lot of knowledge and stuff that she would like to hand off to us.
Well, thank you for inviting me. As you'll see in the video segments that we've done already, we'll talk about seating for a young baby, an older child, a papoose. What we did not show in the video is if you have somebody in a wheelchair, and we just don't have access in the clinic to a wheelchair. The best thing is if they're in a wheelchair that has a headrest that tilts back, keep them in the wheelchair, and you can bring your bracket table and light around them and still stay as hopefully in as ideal a position as possible. That's a very difficult position to be in because you have to accommodate to the client. So you'll try to space those clients out so you're not seeing too many in one day. Do your stretches afterward. Do your exercises at home. Mother or parent, the baby's legs would be wrapped around parent's waist. Mother or a caregiver would be holding the baby's hands. The baby's head is right here. So I can have my bracket table and my light, thank you, so that I have access to all of my stuff. The baby's head is right here. The baby is looking up to mom. So if the baby does get scared, mom is right there to talk to baby. But babies often cry, so don't worry about that. So while the baby's head is here, I can do a full checkup. I can start with my extra oral. I can use a toothbrush handle, retract the lip on one side. As the baby cries or opens, you put the toothbrush handle in there and they can bite down on that. And my other dominant hand, then I can start by using a mirror. I can even start with the intraoral, palpating all the soft tissues, pick up the mouth mirror, look around on one side, and then I can switch sides. I can do the same thing with the Explorer. We always want to check the dentition. What type of enamel does that baby have? How much plaque is there? Is there a likelihood of high caries risk? What is the spacing between the teeth? When should the parent be starting to floss? So I can do everything from this position. Very young children can get calculus and stain just like an adult. So we have to be able to assess and treat. Straddling the dental chair, so you're going to have to show the parent how to sit. Her legs, one leg on each side of the dental chair, facing towards the front of the dental chair. The child would be facing her similar to knee to knee. So the child's legs would go over Shelby's legs. The head is resting here and Shelby would be holding their child's hands again. So parent has direct vision into their child's mouth, which is awesome because many times they don't really look in their mouth, so now they can clearly see what's going on, especially with our light. So again, I have all my equipment that I need to do a regular appointment. I don't have to do anything special. I can use all the ergonomics that I need and I want to adjust to the client. So this is a really simple, easy way, and you can see many, many, many otherwise clients it would be very difficult to see this. Pretend that there's a papoose in the dental chair. So usually for clients or kids that cannot cope with staying still, we use a papoose with assigned consent, and it would lie on the chair and there are Velcro straps around the child. This is where we tend to stand because then we have easier access to all of our equipment and we often have an assistant helping us as well. So it's just a bit more room and every operatory is a bit different. You won't know what height to adjust your chair to until your client is in and the size and height of your client. But remember, you always want your forearms to be horizontal to the floor. So if I try to imagine that there's a client here, I'm probably going to be okay at this height. With the papoose though, their head is still not secure. So you're still going to have to get a headlock, and I still use the toothbrush as well to help keep the mouth open, and then I can go in and I can do an assessment, I can check, I can scale, I can polish, I can do everything with holding the cheek back and mouth off. So it is a little harder, but you can still access all the different areas. When you're standing, there are more compromised to your neck. You do have to bend a bit more, so you always try to space these types of clients out.